Going to study a very quick basics point that you guys should remember, what are about the electrical signal conduction. In electrical signal conduction, we have this is the cycle that is used to determine how the signal is going out in our heart. This is P, this is Q, this is R, this is S, this is T, right? As we all know that heart is a muscle that contracts and pushes blood in all part of our body. Heart is a muscle that does not need anything else to for the action potential to perform any function. It is a boss baby, right? It performs all of its function on its own. There is an SA node in the heart that initiates the heartbeat, that generates via the action potential via the muscles that represent the heart known as cardiac muscles, and that action potential travels via the SA node and then to the AV node and to the bundle of His and then to the bundle branches, then into apex of the heart, where the Purkinje fibers are lying. I'll tell you all this detail in the other video, right? Now this is how the action potential is taking place. This is the P wave where the atrial depolarization take place. What happened here? Atrial depolarization. This is the heart and upper portion is the atria. Here the atrial depolarization is taking place, right? What does it mean by atrial depolarization? When the atria is contracting. Remember, depolarization is equal to contraction. Atrial depolarization is taking place over here. Now we have, after P wave, we have a QRS complex. In QRS complex, again there is high, again there is QRS. Here the ventricular depolarization. What is going on here? Ventricular depolarization, right? Means ventricle is contracting. Atrial depolarization and now ventricle depolarization, right? After this we have T wave, which is known as ventricular repolarization. Ventricular repolarization matlab it means ventricle is relaxing. Repolarization means relaxing. Now you guys might find something suspicious or ambiguous about a thing, that what about the atrial depolarization? Where does it goes? Atrial depolarization is also present here. It is of very small time that we cannot able to mark it. So if you guys are suspicious to know, so it is somewhere here. Atrial depolarization, it means atria is relaxing. Depolarization, right? This is a very small cycle that you all guys should understand or should remember it by heart. There is an atrial depolarization, then we have ventricular depolarization, then we have ventricular repolarization. Repolarization means relaxing and depolarization means contracting, right? Now there is some ambiguity or some things that might happen in few cases, or you might should know that what happens when on the ECG, when you see that there is P, Q, R, S and T, right? This is longer. This is not normally this is not this much longer if there is a longer T wave, right? This is P, Q, R, S, T. That is ventricular repolarization. Ventricular relaxing phase. When it is higher, it means there is a high amount of calcium in the body, right? That is hypercalcemia in the ventricular repolarization phase, right? And if there is flat or inverted T wave like this or like this, what happens in this stage? There is hypokalemia. Hypokalemia. In which state? Flat or inverted T wave. That is the phase of atrial repolarization, right? If there is PR interval prolonged, what happens if there is PR interval prolonged? This. Prolonged PR interval. Prolonged PR. PQR. Sorry. This is only P. I want to draw this whole stuff long, not like this. But P, Q, this goes on PQR, right? This is a bit long, PQR, P, Q and R. If there is PQR interval is long, it is hypermagnesia. Hypermagnesia, right? And if there is a depressed ST, S and T is depressed, like this, PQR, it is also depressed. What happens? Depressed ST, we have hypomagnesia. Hypomagnesia, right? Hypomagnesia and depressed ST. Hypermagnesia in prolonged QRS interval. And this is all for the cardiac cycle action, how action take place, and what are the happens if there is a bit elongation, a bit prolongation, a bit straightening of the any of one waves.